Everyone, welcome to our group presentation/group discussion in the case of Mrs. Mary Finich. Let me start by introducing my group members. My group consists of me, Prashant Sapasnet, then we've got Jyoti Kimire, Ramila Humagai, and Priya Nupane. Now, to start our group discussion, I would like to hand it over to Jyoti first to start with question 1.
Thank you, Prasansa. So I will be talking about pathogenesis of ischemic stroke. Ischemic stroke is a condition caused by insufficient oxygen and blood flow to the brain. In Mary's case, AF seems to be a significant risk factor for stroke, whereas hypertension and diabetes are contributing risk factor. Strokes caused by AF are more likely to be life-threatening because it can lead to the formation of blood clots in the atria, which can then travel to the brain and cause stroke. In this case study, the pathogenesis of ischemic stroke can likely be attributed to the formation of an embolus, specifically a thromboembolism, which occluded the left internal carotid artery ICA. Let's look more into it. AF is a common cardiac arrhythmia characterized by irregular and rapid heartbeats in the atria. The left atrium may develop blood clots because of atria's inability to contract efficiently in AF. These thrombi can then embolize, meaning they can break free from the heart and travel through the bloodstream. Blood flow can be disrupted and clot formation risk is increased by irregular heartbeats in AF. Hypertension is another significant risk factor for stroke. Over time, it may cause damage to the blood vessel walls, making clots and plaques more likely to occur. This damage can also disrupt the integrity of blood vessels, making them more prone to rupture. Diabetes is similarly another risk factor. It can lead to the development of atherosclerosis, which involves the buildup of fatty deposits in the blood vessels. These plaques can narrow the arteries, increasing the risk of clot formation or vessel occlusion. In Mary Fenich's case, it's likely that she had a thromboembolism originating in her left atrium due to her AF. The irregular contractions of the atria in AF can promote blood stasis, allowing clots to form. Once a clot forms, it can travel through the circulatory system. In this case, the clot embolized and became lodged in the left internal carotid artery, causing an acute occlusion. Also, Mary's underlying hypertension and diabetes may have contributed to the development of atherosclerosis and clot formation. Now, for further discussion, I would like to hand it over to my friend Prasansa. Thank you.
Thank you so much, Jyoti. Now, I would like to share what I've studied and what I've learned about ischemic penumbra and the importance of timely reperfusion therapy specifically related to Mrs. Mary Finich. So, the ischemic penumbra can be described as a hyperperfused zone that surrounds the region of complete infarction or the core of an ischemic stroke, where blood flow is compromised. In this area, the related tissue is at risk of severe damage, but it can still be able to function fully with prompt and proper restoration of the blood flow. Now, in the case of Mrs. Mary Finich, timely reperfusion theory is very important in addressing the ischemic penumbra, as thrombolysis with alteplase is administered with the aim of dissolving the clot, which is causing the left internal carotid artery ICA occlusion. Also, this intervention is very vital in avoiding the further damage to brain tissue and reduce any long-term deterioration after a stroke. The significance of timely reperfusion theory is to prevent the progression of the stroke by preserving as much brain function as possible, because there is more chance of preventing any irreversible damage that there is to ischemic penumbra if the blood flow is restored quickly and promptly. So it is also very important as it also enhances the overall prognosis for the recovery of Mrs. Mary Finich. Hence, timely reperfusion therapy such as thrombolysis with alteplase in Mrs. Mary's case is very crucial to preserve the at-risk tissue, minimize the impact of stroke, along with improving her chances of more favorable outcome and Mrs. Mary Finich's smooth recovery. Now, also to discuss about question number three, I would like to hand it over to my friend Priya Nupane.
Thank you, Prasansa. Now I'll be talking about specific nursing consideration for administration of drug for Mrs. Finney. Altiplus is an thrombolytic agent which is used in the treatment of acute ischemic stroke. This medication is used to dissolve blood clots that have formed in the blood vessels. When using Altiplus, which is also known as TPA, for the treatment of ischemic stroke, patients need to be assessed for any bleeding and hypersensitivity reaction. Neurological status and blood pressure need to be monitored during IV therapy. Patients should go under Patients should undergo neurological and cardiovascular evaluation with blood pressure monitoring every 15 minutes during and after the TPA infusion for 2 hours, and then every half hourly for 6 hours, and for next 16 hours. ECG should be monitored before, during, and after the therapy. Nurses need to verify the patient weight and the given medication doses as is accurate, as the dosing is weight dependent. Heparin IV. Heparin IV is used to prevent and treat blood clot by inhibiting the production of fibrin. Therapeutic monitoring for heparin includes the activated partial thromboplastin time, which is APTT, and activated clotting time, ACT. Both APTT and ACT are aspects of clotting time which are prolonged by the therapeutic heparin doses. Monitoring for adverse effect includes hemoglobin, hematocrit, platelet count every 2 to 3 days while on the therapy. Monitoring the vital sign of patient is also crucial. Dosing of heparin varies from the indication and it is weight-based. Nurses should strictly follow the protocol when administering this medication. Labetalol. Labetalol is a beta blocker which is used in the treatment of high blood pressure. Patients on this medication should be closely monitored on their blood pressure, heart rate, and neurological status. Patients should be assessed for any sign of hypotension, bradycardia, or adverse reaction. Insulin Novorapid IV. Patient receiving this medication, nurses need to monitor the blood glucose level regularly. Nurses should monitor for any sign of hypoglycemia or hyperglycemia and adjust the doses of the medication accordingly. Monitor BGL for 2 hours after removing the infusion, then at the standard ward time as ordered by the medical officer. As a nurse, it is crucial to be aware of patient drug allergies and identify the potential interaction of the drug with other medication. It is important for nurses to administer the drug following the 5 hours. Now, I would like to hand over this presentation to our Ramila. Thank you.
Thank you, Priya. Today I'm discussing about the diagnostic procedure that is commonly used to diagnose ischemic stroke. So firstly, completing the history of the patient, physical examination, neurological examination of the patient to determine the extent of neurological deficiency, etiology, location of infract size, and choosing the best course of action for the patient, like me reference. Secondly, brain scanning such as CT scan and MRI. CT scan, computed topography scan, is a computerized scan of the brain which show the existing abnormalities in the brain. Patients who are suspected with acute stroke is referred for CT scan to determine the age and degree of ischemia and also rule out the other pathophysiological conditions including deposition of blood clots in the blood vessels of a brain and neurological impairment. CT scan has much lower sensitivity and specialty for acute ischemia because the net tissue water content changes over hours after the onset of ischemia. MRI, magnetic reconnaissance imaging, is a non-invasive diagnostic procedure which obtains detailed images of the brain through the strong radiation waves and magnetic field. It is an essential diagnostic tool in ischemic stroke, which can easily differentiate between brain tissue at the risk of infection and irreversible damage. It provides enough information on its own, reducing the reliance on any other additional test or complex clinical consideration. Angiography. Angiography is a procedure in which contrast dye is injected through a blood stream for possible visible imaging of blood pressure. So, in the diagnosis of ischemic stroke, CT angiography and MRI angiography can be done. And now I would like to hand over Prasansa for conclusion. Thank you.
Thank you so much, guys. Now, to conclude what we have just discussed, in Mrs. Mary Fenech cases, an ischemic stroke is presented by thromboembolism, which presents a complex medical challenge. Some of the prominent risk factors in her case are atrial fibrillation, hypertension, and diabetes. And timely reperfusion theory like alteplase is very essential for her to protect the penumbra at risk. Similarly, management of medication like heparin, levetolone, and insulin novorapid is also equally important. And the whole diagnostic process includes history and physical examinations and neuroimaging to prepare the treatment trajectory. Therefore, in navigating the difficulties of ischemic stroke, Mrs. Fenech's example highlights the crucial importance of quick intervention, risk factor reduction, and vigilant monitoring, emphasizing a customized and all-encompassing approach to care. So thank you so much, guys. I think we've learned it all. Thank you so much for joining me.
Thank you, Prasansa.
Bye.
Thank you, everyone.